Hello, thank you so much for joining us. Today we're talking about different types of mammograms. We're joined by Dr. Danielle Summers, who is a staff radiologist at Banner MD Anderson Cancer Center. Thank you so much for being here, Dr. Summers.
Thanks for having me.
So let's go over those types of mammograms. How many are there and what are you looking for in each one?
Yeah, so there's two different types of mammograms that we do, screening mammograms and diagnostic mammograms. Both of them we use to detect breast cancer, but there are some differences between the two. So screening mammograms are routine exams that we're doing to evaluate for breast cancer. A woman comes in, gets the exam done, and then leaves, and we read it after she leaves, and she usually gets the results within about a week or so. A diagnostic mammogram is performed if we see an abnormal finding on that screening mammogram or if the patient has a symptom, such as a palpable lump or nipple discharge, so that we can further evaluate that. That the radiologist reads in real time, so if they need additional imaging, such as extra mammogram pictures or an ultrasound, we can do that at that time and they get the results the same day.
Will you explain for us the categories of the findings?
Yeah, so in breast imaging, there's 5 different categories usually that we use after an evaluation is done to let somebody know what our results are. So the first 2 are category 1 and 2, and that really is negative or benign. And in the end, that just means that everything's okay. We don't see anything worrisome, and a patient can just return to getting their normal screening mammogram the following year. The next category is a category 3. And that's when we see something and we're not sure, we think it's nothing to worry about, but we just want to keep a slightly closer eye on it. That's literally called a probably benign finding, and that's just because there's a 98% chance that it's benign, meaning that it's absolutely nothing to worry about. But we're going to keep a close eye on it, usually for 2 years, to make sure it doesn't change to be safe. The next 2 categories are categories 4 and 5, and that's when we see something that we think is suspicious, and so we want to go ahead and get a biopsy to further evaluate that. So we'll get a small little piece of tissue from that area so that we can send it off and find out if there's anything going on there.
Okay, now it's everybody's fear, being one of the women that has to come back for further screening, and that's why this is so important. But what do you want women to know if they are in that group that needs another look?
Yeah, absolutely. So I think the most important thing is that I want women to know that even though I 100% know that they're going to feel a little scared when they get that letter or call that they need to come back for additional pictures, that I want them to try their best not to worry. Because we call back about 10% of women that have screening mammograms, but less than 10% of those women will be found to have a breast cancer. So most women will be told that everything's okay, but we want them to come back to get evaluated because our goal is to catch those cancers early when outcomes are better and treatment is more effective and better tolerated.
All right, great information. Thank you, Dr. Summers.
Absolutely.
And thank you for joining us. If you would like to schedule a mammogram, just click on the link in the caption.